This Lunch and Learn series is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. We ask that everyone stay on mute during the event and submit your questions through the chat box. If you have any questions that you would like to submit anonymously, please send them to me and I will send them on to Dr. Eisenberg. You are also welcome to post any questions so that everyone can see. I'd now like to introduce Dr. Nancy Eisenberg. Dr. Eisenberg is the medical director of the Center for Healthy Aging at Swedish Neuroscience Institute and Providence Health and Services, and co-leads Project Echo Dementia. She is a subspecialty trained behavioral neurologist and neuropsychiatrist with expertise in implementation science, clinical neurodegenerative disease, and functional brain imaging. She has 25 years of experience in medical care for persons with Alzheimer's disease and related disorders and care for their families. Dr. Eisenberg will start with an approximately 20-minute presentation, followed by 30 minutes of Q&A, closing up right around 1 p.m. And with that, I will turn over to Dr. Eisenberg.
Thank you, Marnie, for that very kind introduction. I'm delighted to be here with you all today, and I'm going to talk about the 7 habits of healthy aging. And as you see on this introductory slide, you may notice that there are only 6 here, and we'll come to the 7th as well. So we're going to talk about diet, exercise, the importance of social engagement and connection, how to best manage stress, how to stay cognitively engaged or work that edge of continuous learning with a growth mindset, and the importance of sleep. And then also sort of that 7th component, which is so key and which really is connected to each of the other 6, is a healthy mindset and really working with a team-based model of care where you have a good collaboration, a careful assessment of medications, and really connecting with your care providers in a partnership to flourish. And on the right hand of this slide, I've exhibited Dean Ornish's Undo It approach. I just thought I would mention. And so really he distills it to how you manage stress, how much love and support you have in your life, how much you move, and how well you eat. And as I've said previously, 40% of dementia cases are preventable across the lifespan. And if you have cognitive challenges and dementia, by implementing these approaches, you can slow things down and with a strengths-based approach, improve and rely on certain areas of functioning to really thrive, given, come what may, in a context of support and collaboration. Okay. So here, we've talked about this as we live longer, there are more people with Alzheimer's disease. Over 5 million Americans presently have Alzheimer's, almost 6 million. And the single greatest risk factor for Alzheimer's disease is advanced age. And so the longer we live, the greater our chance. And as you see, almost 1/3 of people in their 80s have Alzheimer's disease. And primary prevention really targets cardiometabolic risk and stress management as well. So as I have mentioned in my previous talk, there are disparities in terms of the prevalence. So whereas the single greatest risk factor for Alzheimer's disease is advanced age, African Americans are 2 times more likely than non-Hispanic white Americans to have Alzheimer's and other dementias, and Hispanics, depending upon the study you're citing, between 1.5 to 2 times more likely. these individuals are typically diagnosed later in the disease, which of course reduces their access to programs and services. And almost 2/3 of older Americans with dementia are women. So we also know, based on the science, that the neuropathological burden accumulates gradually over decades. And so as you see in this slide, you can have years and years where you're doing very well functionally in the world, but there's accumulation of this change. And this is the pre-symptomatic phase, which can precede the onset of any symptoms by some decades. And then there is something we term the prodromal phase, which is mild cognitive impairment. And at this phase, you're living well, functioning independently, but may have some memory issues or other attentional issues or problems with calculations or those kinds of things. But all in all, you're doing quite well. And then in time may develop dementia. So as I say, the pre-symptomatic phase with the accumulation of burden can happen over decades. You can also live in the prodromal mild cognitive impairment stage. And what we'd like to do is really to target risk with lifestyle medicine in order to change that curve. So as I said, there is a gradual accumulation of the pathology over decades, and the hope really, we don't presently have disease modifying therapies. However, we know that if we target cardiometabolic risk, that can decrease the neuropathology as well. So whereas we don't have a pill or a procedure presently, we do have approaches that we're going to dive into today that can really change the brain and can change your overall functioning. And this is very exciting. To ideally maintain that pre-symptomatic phase and functional independence and thriving. So as I reviewed in the last Lunch and Learn around research updates, the Lancet Commission came up with their second big analysis, the first being published in 2017. And in 2017, they found that 1 in 3 cases of dementia were preventable over a lifespan. And now, and the wonderful news is that actually 40% of cases, as I mentioned earlier, are preventable over a lifespan through targeting these risks. And as you'll see later in the talk, education really features very prominently, not just in terms of early education, but continuing to challenge the mind to grow these connections and to learn. Lifelong learning, really critical. So early on is lack of education as a risk. In midlife, hearing loss, traumatic brain injury, hypertension, excessive alcohol use, and obesity. And later in life, smoking, depression, social isolation, which with COVID now is rampant, physical inactivity, air pollution, and diabetes. And as I said, this really accounts for potentially 40% of the risk. Okay, so our first habit that I'm going to talk about today is stress management. And, you know, if the pandemic and many challenges with violence and people losing their jobs and isn't enough, we've got all sorts of things that we have to manage day to day. And so how can we really manage that stress so that it doesn't become toxic? Because when stress is toxic, it actually harms cells in the brain. It also affects immune response and endocrine function and a number of other systems in our bodies. And what we're going to target on today really is the brain, and because we're talking about habits of healthy aging and the mind and memory and cognition, but they are all really interconnected. And so You know, we know that if we're overwhelmed, we thought block, we can't recall things. And I'm sure most of you have had those instances when you're feeling anxious, you're not as able to articulate your thoughts. So really kind of managing stress both in the moment and then also to manage chronic stress is really key. And so we know, for example, that breathing long exhalations, the kind of soft belly breath is really helpful. It can help focus attention and also release endorphins. And these endorphins can boost our immune system. They can help us. We have more pain tolerance. So even social discomfort type of pain. So really, when we're feeling overwhelmed, a simple practice can be just a long exhalation, that breath awareness. And thankfully, it's free. It's always with us. It's something that we can do that can really help us to reset our neurophysiology. So another piece is the mindset medicine, having a positive outlook, and we'll speak more about that later. But I wanted to cite a couple of studies around the importance of meditation and breath practice as a form of meditation. And so some people will like to practice daily affirmations. And we also know that a fixed mindset can really interfere with our ability to problem solve in the moment or to be flexible or nimble with our thinking, whereas a growth mindset can be more opening of our ability to see things. That can widen our perspective and help us to thrive, to recall words, to articulate an argument, to be nimble with our thinking and problem solving. So to really focus and to succeed in the world. So this is another study that I thought I would cite. That came out in 2016 and looking at meditators compared to people who had not been meditating. And at age 50, the brains of these meditators were quite a lot younger, as you see, 7.5 years younger than those of controls, looking at their brains in an MRI scan. Many of you have had these MRIs, and we've looked at them in the office together. And then this is a study that came out of Becca Levy's group at Yale, looking at positive compared to negative associations around aging in 4,000 individuals. So over 4 years. And in that group of people, 4,000 individuals over 4 years, a quarter of them had ApoE4, which many of you know is a susceptibility risk gene for the development of late onset Alzheimer's disease. So those individuals who had positive associations around aging, such as aging confers wisdom or aging allows me to be a grandparent, this was protective, not only for they lived longer, but they also had a lower incidence of dementia over those 4 years. And this was statistically significant, as you see here and here. And importantly, for those individuals who had this ApoE4 susceptibility risk, this demonstrates the epigenetic modulation of this risk based on a belief. So epigenetic modulation of a genetic susceptibility based on a belief with a statistically significant difference based on mindset. So kind of finding the positive, glass half full, positive associations around aging are all really health promoting. Not, of course, in a Pollyanna-ish way. You want to acknowledge the full catastrophe or the gamut of feelings. And at the same time, if we get stuck in the negativity bias, as we are predisposed to do as humans, that can ultimately cause harm to our nervous system and accelerate aging. Okay. So this is an app that was developed at University of Wisconsin with Richard Davidson and his group called the Healthy Minds Program, and you can download it for free on your iPad or your iPhone or your Samsung or your tablet. And it focuses on the 4 constituents of well-being that have been scientifically studied over the past 4 decades. And those are awareness, which can improve concentration and attention, which is really key for us as we age and as we can become more distractible in the 21st century. It can also help to cultivate connection, insight, and purpose. And he talks about it as though it's the mental floss. Like, we didn't used to floss our teeth, and now everybody does. And so this is a form of mental floss, this Healthy Minds program, which some of you may be using now. And here's the science demonstrating that it has shown increases in focus. You know, who doesn't struggle with distractibility these days with all our, you know, phones and computers and so on and so forth. So really cultivating that muscle of attention is so key. And then if we're more resilient and improve our balance, it can also help lead to better health. So meditation and mindfulness-based programs have been shown also to impact the immune function and may help to treat these chronic conditions. Okay. So we're now on to the second habit, which is a whole food plant predominant diet. So heart disease is the #1 killer still in the world. And unfortunately, the mortality rates are increasing and driven by diet, lack of exercise, and lifestyle choices. And so, you know, we have dual epidemics. We have the pandemic now, and we have this epidemic of heart disease and chronic conditions, obesity, type 2 diabetes. And plant-based diets have been shown to be associated with lower rates of obesity and diabetes and longer life expectancy. And some people talk about Alzheimer's disease as type 3 diabetes. And I don't think that we speak enough about the relationship between diabetes and dementia risk, despite the fact that diabetes is a significant factor that contributes to risk of Alzheimer's disease and vascular dementia. So it also is associated, whole food plant predominant diets are also associated with better management of hypertension, dyslipidemia, stroke, all factors which contribute to dementia risk as well. So this is a study that came out now 5 years ago, looking at something called the MIND diet, which is a combination of the Mediterranean diet and a low salt diet. For those who have hypertension, the DASH diet may be familiar. That's a diet that focuses on a lot of fruits and vegetables and limiting of salt. And in these individuals who were followed almost 5 years, there was a 53% reduction in the incidence of Alzheimer's disease. And so in addition to the 10 brain healthy food groups that you want to increase, you also want to avoid red meats, butter and stick margarine, sweets, cheese, pastries, and fried and fast food. So again, really kind of the whole food plant predominant diet here, avoiding processed food. If it has more, you know, if you don't know what the ingredient is, maybe that's not something that you want to put into your body. And, you know, we can think about an 80-20 rule, not to get too strict. So of course, you may not want to adhere to it all the time. Give yourself permission now and again to enjoy what you savor. And at the same time, the science is very robust that, as Hippocrates said, you know, let thine food be thy medicine and thy medicine be thy food. Okay, so as I alluded to early, epigenetics is a new field in medicine that has demonstrated that, you know, lifestyle can really impact genetic risk in many cases, and in particular for late onset Alzheimer's disease and the susceptibility risk of ApoE4. So as you see here at the population risk level, you know, for dementia, maybe 60% is genetic, but unhealthy lifestyle, you know, is a 6 times force multiplier, whereas you can really cut that in half with healthy lifestyle. Okay. And this was just a study that came out of the New England Journal looking at lifestyle approaches and diabetes prevention, demonstrating that those who adhered to, and this was diet and exercise primarily, it wasn't a specific diet, it was just a whole food plant predominant type of a diet and exercise, you know, had a lower risk of developing diabetes when compared to metformin and placebo. So the other component for many of you who may be living with diabetes is that if you can keep your A1C 7 or less than 7, then you can really avoid the complications of diabetes. So that's very important to know. And so in this EPIC study of over 20,000 people who were exercising over 3.5 hours a week, they were not smoking, they were consuming a healthy diet, that's to say, low glycemic index foods, lots of fiber, not sugary sodas, and they had a pretty healthy weight for them. They prevented 93% of diabetes, many heart attacks, strokes, and cancer as well. So moving on to habit 3, exercise. Now, exercise has 4 components, and today I'm really going to focus primarily on aerobic exercise because that's where the most science in association with cognition resides. However, I want to just briefly mention that it's very important also to practice balance, and that can be done with Tai Chi or yoga or with a trainer. It's important to do your strength training because we want to build muscle to help to stabilize our bones. And it's important also to have a flexibility or stretching regimen as well. But in terms of brain health, there's most data on aerobic exercise. So walking for 3 hours per week for 3 months caused so many new neurons to grow that it actually increased hippocampal volume. And as I said earlier, the hippocampus is this area of the brain that's really vital for learning and memory. And neurogenesis, or growth of new cells, occurs there. So this is really a very robust demonstration of this relationship. And here you see that this was a study that looked over the course of a year, and the cardiovascular aerobic exercise in this particular study was walking. So, you don't have to be running or cycling quickly. Walking is sufficient. And people who walked compared to those who were just stretching their bodies had a significant increase in the size of their hippocampus over the course of a year. And normally over the course of aging, the hippocampus shrinks. So the fact that they were able to demonstrate growth in this region of the brain that is so vital for learning and memory, and which is vulnerable to early changes in Alzheimer's disease, is quite inspiring. And the range of age in these people, the oldest was in mid-80s. So, these were folks between their 50s and 80s, and it followed over the course of a year. And the reason that we see the caudate and thalamic size is we wouldn't expect that there would be neurogenesis in these areas of the brain. Okay. So moving on, there is also some science less robust around the importance and that strength training can help neurogenesis in the hippocampus as well. But really the most robust is for walking. And the American Heart Association is recommending 150 minutes or 30 minutes daily, 5 days a week. It doesn't have to be done at once. You can do it in 10-minute bursts. So key. And it's as important now as it ever was. So really trying to make that happen. And if you can't walk, then, sometimes a recumbent bike or a new step or swimming, these things can be so helpful and also so enlivening. So the 4th habit is sleep. And here you see that, we have this circadian cycle where when it's light out, we can enjoy the daytime and we eat and we exercise, and at night, really ideally, we should be sleeping. And so sleep has a number of functions in the early phases of sleep where we have a lot more deep sleep. We have this restorative sleep and we consolidate memory. And in the later portions of sleep, when we dream, there's some kind of release of emotions and some problem solving. We can have very creative thinking during REM sleep, which tends to happen in the later portion of the night or the early morning hours. So, and on average, this is from the Sleep Foundation. As we age, we need less sleep, as you see here. However, really, we need between 7 and 8 to 9 hours when we're over the age of 65. And this is from Matt Walker's book about sleep. So he says, scientists have discovered a revolutionary new treatment that makes you live longer. It enhances your memory and makes you more creative. It makes you look more attractive. It keeps you slim and lowers food cravings. It protects you from cancer and dementia. It wards off colds and flu. It lowers your risk of heart attacks and stroke, not to mention diabetes. You'll even feel happier, less depressed, and less anxious. Are you interested? I imagine we're all interested, and that is, of course, sleep, right? So cognitive behavioral therapy for insomnia is the most well-studied approach. It was developed at Stanford, and many people do suffer from chronic insomnia. So I encourage, we have a wonderful sleep center here, and I encourage you, if you are having challenges with sleep, to consider being evaluated and seen. And you may have untreated sleep apnea as well, and there are treatments, very effective treatments for this. So poor sleep really can cause decreased immune function. How many of you probably have had an experience in your life where you haven't slept so well because maybe you've been traveling or preparing you've had a lot of work on your plate, or and then you get a cold? It really can decrease this immune system functioning. It lowers your pain tolerance. You can be more irritable, more sensitive. You have worse kind of sugar control or glucometabolic control, and really can increase your carbohydrate cravings by reducing leptin, which tells the brain that you have satiety or that your stomach is full. And it increases ghrelin, which is that eat hormone. And as I said, you really want to make sure that if you snore loudly or you have excessive daytime somnolence, that you see someone in the sleep clinic to be evaluated for possible sleep apnea, because this can also affect memory function and increase your risk for stroke and heart attack and many other conditions. So whereas good sleep really promotes cell regeneration, as I showed you, it consolidates memory. It helps us to be more nimble in our thinking. So if you're having difficulty sleeping, this is a nice kind of acronym for sleep, for things that may contribute, such as substances like caffeine at night, for example, or too much sugar. Are there particular life stressors? Did you have, as I said, a lot of sugar? Is there too much light in the room? Could you have some endocrine imbalance or something? And then are you feeling a lot of, overwhelm or stress? And cognitive behavioral therapy can be a great approach, as I said earlier. But sleep really affects all of these domains, as we demonstrated. Okay. So I'm not going to read everything here, but just because I think we've touched upon it, but it's very restorative. And as you see, number 5, brain health, it can really enhance the neuroplasticity. And some of you may have read how when you sleep, there's something like a lymphatic system for the brain that kind of washes those protein aggregates that I spoke about earlier that accumulate over decades to cause Alzheimer's disease. So that plaque and tangle deposition in the brain that accumulates over decades, some of this is washed away with restorative, restful sleep, on average, at least 7 hours a night. So very important in terms of enhancing neuroplasticity and also clearing out those pathological plaques and tangles. So habit number 6 is really the importance of connection. And people who are suffering from loneliness, depression, or isolation have 3 to 10 times the risk of premature death. And particularly in COVID, as we spoke about, we don't want to socially isolate. We want to physically isolate to stay safe, and we want to socially connect. And this is really, the elderly are especially vulnerable in this day and age. And so really being intentional, getting on the phone, sending a letter, connecting to people at a safe distance, of course, wearing your mask, yes, keeping the physical distance, and yet really understanding that isolation and loneliness can really harm us and accelerate aging and worsen cognition. And conversely, intimacy is really healing. And you really only can be intimate to the extent that you feel safe. So when I'm talking about intimacy here, I'm talking about an environment that is trusting and supportive, where you can feel seen and heard. And it really can be very, very healing. Okay. So the next habit is cognitive engagement. And we spoke about the vulnerability for those who don't have access to education, the vulnerability for Alzheimer's disease and dementia, if you're not able to access education. And however, if you can continue to engage the brain, challenge the mind, this is really neuroprotective. So you can learn something new, such as the piano or a new language or a new dance, but really find that thing that you want to challenge the mind with and pursue it. And it can often be pursued in the social context because we know that we learn better, many of us, in a supportive environment. So just to review what we've been talking about in terms of increased risk, things like, traumatic brain injury. And when we say this, we mean multiple injuries, usually with, very, like, for example, playing football and having multiple concussions, for example, not just a mild concussion. Most of us will have had a concussion over a lifetime. Midlife obesity, hypertension, smoking, diabetes, depression, sleep disturbances we've been speaking about, and hyperlipidemia. And then things that really decrease the risk are formal education, years, and this cognitive engagement, as we discussed, continued physical activity at whatever phase and stage, the Mediterranean or whole food plant predominant diet, some challenging the mind, making sure you don't consume more than 21 units of alcohol per week, and social engagement. So how can you engage? Well, there's these different domains: education, cognitive stimulation, and social engagement, and they're not separate, right? They can inform one another. So volunteering or meeting friends, reading, and participating in a book group, doing puzzles or crossword puzzles, learning the second language, as we mentioned. All right. And really, all of these things are important, and there is a synergy. So doing them together is better than doing each of them alone. There is kind of this synergy or an effort that is the combination, the benefit of the combination exceeds the summation. And so this was a study out of Finland, a 2-year study looking at, targeting diet and exercise and cognitive training and really targeting vascular risk. And in these individuals, there were over 1,000 people between the ages of 60 and 77 who had an increased risk of dementia based on hypertension, hypercholesterolemia, obesity, based on it's a risk stratifier called the CADI risk scale. And half of those people had a multi-domain intervention, and half of them had their normal care. And in those who participated in the multi-domain intervention, which had dietary counseling, exercise, cognitive training, social activities, and really targeting this vascular and metabolic risk, they had a significant improvement in their overall cognition, their speed of processing, their memory, and they had a slower rate of cognitive decline. So this was the first study of its kind to demonstrate over 2 years that this multimodal intervention has an impact. And this is now being replicated worldwide. It's called the Worldwide Pointer Study. Okay. So as I've shown you, really, I think lifestyle is medicine. And this is a study that came out just this year, looking at combining these multiple healthy lifestyles, which is more impactful, as I've shown you. So in looking at people who had a healthy diet, moderate to vigorous physical activity, light to moderate alcohol intake, they did not smoke, and they stayed cognitively engaged. If you combined 4 or 5 of those, they had almost a 60% lower risk of developing Alzheimer's dementia. And even with 2 to 3, because sometimes it's hard to adhere, you still had a significant risk, almost a 40% lower risk. And as I showed you with regard to the ApoE study, it may, and they looked here at ApoE4, it may even offset the risk associated with that, as we said, susceptibility risk. So really treating these modifiable cardiovascular risk factors, exercise, sleep, and alcohol, having a very, very thorough and careful look at medications, even over-the-counter medications, Unisom or Benadryl can be harmful and increase your risk for dementia. So you don't want to take any of those. And you want to make sure that when you talk with your doctor, you tell them not only the medications that you're taking that are prescribed, but also the over-the-counter medications that you're taking. Increasing your exercise, as we've discussed, challenging the mind in a socially engaged way, considering a whole food plant predominant diet, and then these ways to manage your stress, which can really be toxic, and to stay engaged in community. So coming to the 7th habit, we know that information is unfortunately not sufficient to motivate us for sustained behavioral change. So to really make these sustainable lifestyle changes, I mean, if it were sufficient, then nobody would smoke, right? And nobody would have sugary drinks. But information itself is not sufficient to motivate most of us to make these sustainable lifestyle changes. And so at the Center for Healthy Aging, what we will introduce in this COVID pandemic time is a virtual shared medical appointment. And so we really at the Center for Healthy Aging are committed to providing this evidence-based, patient and family-centered healthcare through our building an intraprofessional team-based prevention and collaborative care strategies and programs. And we're very excited to launch this 2021 Lifestyle Medicine Virtual Shared Medical Appointments. And before I come to a close here, I want to just really take a moment to just acknowledge that much of what we do and what we aspire to do at the Center for Healthy Aging relies on the philanthropic support. And in addition to the medical care that we provide, many of these programs that we are offering, such as today as we're learning together, and as we hope to offer more and more in this comprehensive center, are really value added patient services. And so we can't bill to insurance. So this philanthropy really plays this critical role to support programs like caregiver support programs or population health educational events or other supportive services that fall outside of that regular clinic visit. And it allows us to do more of, like I said, these types of lunch and learns. And so to really focus on improving quality of life, health span, and the times that we have with one another. So we're not fundraising to keep the doors open. We are partnering with our community so that we can create a premier comprehensive destination for the prevention, the care, and the treatment of dementia. So I really encourage you to visit the Swedish Foundation website and learn more about how you could support the Center for Healthy Aging at Swedish Neuroscience Institute. Thank you. And with that, I think I'll look in the chat, and I'm happy to answer these questions. So the first question is, how significant is hereditary? So fewer than 1% of cases with Alzheimer's disease are the early onset genetic form, which is the presenilin 1, presenilin 2, or the amyloid precursor protein, a very, very small percentage. And as I said, in the late onset forms of Alzheimer's disease, there is an ApoE susceptibility risk, ApoE4, but this can be modulated with the lifestyle approaches that we have touched upon, these 7 habits of healthy aging. And as I showed you in the data slides, that can significantly impact the risk. So it's a very small percentage. So if you had a parent who had Alzheimer's disease and they were, not 65 or younger, if they were older than 65, the likelihood that they have a late onset form is very high. And the single greatest risk factor, as we discussed, is advanced age. And so if you had a parent who had either mixed dementia or Alzheimer's disease, when they were older, then it's not so likely that it's hereditary, in the same way that risk that I spoke about with fewer than 1% of individuals, the early onset risk. If you have a parent who who developed Alzheimer's disease in their 50s, that may be a different story. And thankfully, we have genetic counseling here. And in those individuals, if you do have a copy of the gene, the presenilin 1, 2, or amyloid precursor protein, your chance is 1 in 2, and it's autosomal dominant. So that's a different, but that is the minority. That is the minority. Okay. So the next question here is, the question is, how can I stay healthy during the holidays with so many temptations? So that is such a great question, because, we want to set ourselves up for success, right? We don't want to be in this kind of vicious cycle of setting a goal that you can't reach and then beating yourself over the head about it. So I think an 80-20 rule is fair. And if you're coming together with family and, food is so important culturally and from the family perspective, and it has so many symbolic meanings and it's so nourishing in so many different ways that, I think want to think hard about whether you want to say go offline for that period of time and then come back onto the whole food plant predominant approach, or whether it's important to you to set yourself up where you want to really adhere. But I think honestly, the goal is sort of the marathon of healthy behavior. So implementing those 7 healthy habits along the life course. So once in a while, if you savor that piece of cake, or you have whatever you're going to have, I think we're human, of course, right? So we want to be kind with ourselves in those instances. On the other hand, if it's important to you because you've been implementing these new patterns of eating and you want to maintain that, then you could sometimes call the family members and tell them this is your intention and try to stick to that goal. So it depends on how motivated you are, what the importance of it is to you. And, I think being kind, and then in the big picture, trying to kind of incorporate as much as you can of a whole food plant predominant diet, because it really does significantly impact your risk of these chronic conditions, which can lead to Alzheimer's disease, as we reviewed the science earlier. Okay. So another question here is excessive dreaming bad for the brain? So no, it's not bad for the brain. There are certain conditions where you have dream enactment. That's called a REM behavioral sleep disturbance. I didn't really talk about that. If you are acting out your dreams, that can indicate some different things that you would tell your doctor, and then they could either evaluate you or refer you to the sleep clinic, because enacting your dreams can sometimes be associated with an increased risk of certain conditions. But excessive dreaming, many people are vivid dreamers, and it can help us just to process information and help us to think nimbly. Another question is any supplements that I recommend? And this is a very common question. And the FDA does not regulate nutraceuticals, as I've said before. It's a very big industry where we don't have a lot of science. So I think that it's important to diagnose and treat any nutrient deficiency. So frequently people are low in 2 micronutrients, vitamin B12 and vitamin D, particularly in the Pacific Northwest. So people should, in the Pacific Northwest, take 2,000 international, have that vitamin D tested, and then in the winter months, take 2,000 international units of D3. If it's very low, you may require a prescription of a higher dose at a weekly dosage. So you want to test it and then take 2,000 IU of D3 during the winter months. We also frequently are low in B12 because of malabsorption, because some of our prescription medications interfere with the absorption of this micronutrient. So it's a water-soluble vitamin. So it would not harm people to take 1,000 micrograms of B12. And you could also check with your doctor if you have a deficiency in that vitamin. Okay. But in terms of taking a supplement, I'm not recommending any supplement. Any thoughts on the Keep Your Mind Great supplements as seen on commercials? Another question from another person. So really the direct to consumer advertising is very seductive, and it's a multi-billion-dollar industry. I don't know that there's science. On the other hand, if you came to me and you said, Doc, I bought this and it's really helping, and you didn't think it was harming you and it wasn't too expensive, I'm not going to necessarily, if I did not think it was hurting you, tell you to stop it. Okay. So the way that you participate in the shared medical appointment is you reach out to the Center for Healthy Aging and let us know. And we are launching that. It's a virtual visit, as I said, in 2021. And we're going to really focus on using all the new science to help people to sustain behavioral change that can improve overall health and reduce dementia and stroke risk. Okay, so let's see here. So for somebody who has mid-Alzheimer's disease, are there things to do? And yes, there are always things to do, absolutely. And staying connected with community, working your growth edge cognitively, staying healthy from a physical standpoint and an emotional standpoint, and staying connected with your family, really key. Also thinking about and planning for the future, very important as well. Okay. We did talk, there's a question about brain building apps, and we did speak about that Healthy Minds program, which I encourage everybody to take a look at and work with. And it's 5 minutes every morning, and it's science informed and it's free. So yes, that's the one that I'm recommending, the brain building app of the Healthy Minds program. Okay. There are many our brains are changing all the time, either wittingly or unwittingly, based on where we're focusing our effort, our attention. It says where your attention goes, energy flows. So, and neurons that fire together, wire together. So really we're building brains all the time based on everything that we do. All right. And then, I'm actually curious to put this out to the group because I'd love to see what your thoughts are. So my question to all of you is, if you had to choose and have a habit that you're going to focus on in the ensuing months that kind of resonated with you or spoke to you, or where you have an opportunity to implement change, what might that habit be for you? Feel free to put it in the chat.
I don't know how to put it in the chat. Can you hear me?
Yes, or just speak up.
I think lifelong learning is something I'm devoted to.
Okay, thank you. So that says pickleball, cognition and learning, exercising more. So those are great. And when you're thinking about exercising more, which is a wonderful idea, as we said, the American Heart Association, 150 minutes per week, and really give yourself a goal that is achievable to you, so that you set yourself up for success. And whether you want to calculate that based on steps on your phone or whether based on time, really set yourself up for success. And again, really connecting that to this is significantly improving my cognition. I'm growing brain cells in areas that are vital for learning and memory. If you really think that through, it can help strengthen that motivation and help you to stay consistent. So then another one is lifelong learning. Many lifelong learnings get more sleep. Yes, super important. So more sleep, more exercise, more learning, more connection as we're doing here together now. Any other last questions as we're nearing the end of our learning together?
Yes. Have you studied anything about the connection between laughter and staying positive, and say singing, and look at only the positive things in life to stay content?
So that's a great point, that as we talked about with awe or positive, sort of having a positive outlook or a positive mindset, it's really key. And there is some science about laughter actually, and laughter is a really good form of meditation. It can shift your focus and it can actually really soothe your autonomic nervous system and help you to kind of work through the stress. So true laughter is a wonderful practice. And cultivating positive emotions is a fantastic and really one of the key components of healthy aging.
Okay, I think that does it for questions. We want to thank everyone who participated today. If you have additional questions, please feel free to reach out to us at snineuroeducation@swedish.org. As we noted earlier, we did record this event, so we will be emailing the group as soon as it's ready, probably early next week. And we will also post it online at the Center for Healthy Aging website. Again, thank you everyone for joining us today. One more thing, our next event is in January. It is also posted online at Center for Healthy Aging, and we'll send you a link to sign up along with the recording for today.
Great.
Thank you.
Thank you.